So let's go over the blood supply to the scapula. As a precursor, kind of an overview, on the left-hand side of the screen here, we have a nice shot, a very rudimentary, very cursory shot of the cardiovascular system. As we know, blood's going to come out of our heart. It's going to travel up the ascending aorta. The ascending aorta is going to give off some branches. To our right side, we're going to have the brachiocephalic trunk, which is then going to split into the right common carotid and right subclavian. On the left-hand side, however, little different presentation. Completely off the aorta, straight off the aorta, with the subclavian and left common carotid. So we need to make sure that when we're talking about blood supply, especially with these branches, carotids, subclavian arteries, that we differentiate right versus left. Remember, right side is going to have the brachiocephalic trunk, left side is not going to have that. So the part that we're going to zoom in on is going to be the right subclavian. We're going to take the right subclavian and we're going to move it over to the scapula. Now what we're looking at here on the right-hand side of the screen, this is a posterior view of the scapula. We know that because we're looking at the spine of the scapula and we can see the acromion. Obviously you can see the acromion from the anterior view as well, but the spine of the scapula will be viewable on the posterior side. That's how we know we're on the posterior side. So here's what happens. Remember, right subclavian artery, it's going to travel. Subclavian literally means under the clavicle. So the right subclavian is going to travel right underneath the clavicle. Okay? The right subclavian and the left subclavian are going to give off a few branches. One of those branches is going to be something called the Thyrocervical Trunk. So this branch right here is the Thyrocervical Trunk. The branch that we're going to be concerned about for our scapula is going to be this branch right here. This is going to be my suprascapular artery. My suprascapular artery, along with my suprascapular nerve, are going to travel in the suprascapular notch. That little notch is just above, just on top of the scapula. We're going to see this suprascapular artery come right behind, literally where the spine of the scapula starts to separate off of the actual body of the scapula and starts to become the acromion and wraps right around that little area. The other thing that's going to happen is, remember, here's my subclavian. My subclavian artery will continue as it passes past the scapula. It's going to travel now down, and it's going to continue on down to become my axillary artery and then my brachial artery. Here's my very rudimentary humerus. Just to kind of give you a sense of where we are in the body. Now, the subclavian artery is going to give off several more branches, especially when it becomes the axillary artery. It's going to give off even more branches. One of those branches is going to be the subscapular artery. So this guy right here, subscapular artery. subscapular artery is going to give off a couple different branches. One of those branches is going to circle back, and it's called the Circumflex Scapular Artery. So this is my Circumflex Scapular Artery. We're also going to have another branch that happens here. Off the subscapular, we're going to have something called the Thoracodorsal Artery. Now we should be seeing some themes here. So if this is my Thoracodorsal Artery, you should already be thinking, okay, what muscle lies in that region? Obviously, latissimus dorsi lies in that region. Remember, latissimus dorsi is going to come up from our lumbar spine, travel in, and attach into the intertubercular sulcus of the humerus. My thoracodorsal artery is going to sit literally right next to my thoracodorsal nerve. Now, the other branch that we're going to see is we're going to see another branch, in most cases, come off directly off the subclavian artery. That's going to be this artery here. And this is going to be my dorsal scapular artery. Now, my dorsal scapular artery is going to run with my dorsal scapular nerve. So what do we have here? We see the subclavian gives off this branch, dorsal scapular artery. And we see what happens down here at the inferior ankle is that these two arteries are going to connect. Now, when two arteries connect, we're going to use a term. It's going to be called anastomosis. The plural of that is going to be anastomoses. Literally, all that means is that those arteries are connecting in. Okay? There is a very, very special reason for that, a very particular reason for that. We're going to see an anastomosis happen here between the dorsal scapular artery and the thoracodorsal artery, right there. We're also going to see the circumflex scapular artery, because remember, it's circling up, it's in the name, literally says what it is what it says. It's the artery that circles around the scapula or wraps around the scapula. Anytime we see the word circumflex, we're going to think it wraps around. We're going to see that time and time again. So my circumflex scapular artery wraps around, and then we're going to see another anastomosis point with my suprascapular artery right here. So now I have two anastomosis points. I have anastomosis between the dorsal scapular artery and the thoracodorsal artery. I also have an anastomosis between circumflex scapular artery and my suprascapular artery. Now here's why. Our bodies are built for survival. We really, really are. And we're built for adaptation. The reason that an anastomosis is so important is because when an infarct happens, when an injury happens, when a dysfunction happens to my blood supply, I still have other areas that can get the pertinent vital parts blood. That's what I need to do to survive. So if I have my suprascapular artery gets cut, okay, let's say we have an infarct here, and no blood traveling anywhere down past that infarct, look what happens here. I still have my subclavian artery coming down. It gives the subscapular artery off. That gives a branch of the supraflex scapular artery, and I still can get blood to my scapula. I still can give blood to those vital tissues. Same thing if my dorsal scapular artery has an infarct and I don't get any blood past that infarction point, I can still get blood through my thoracodorsal artery. I'm still going to get blood coming up through, and I can still keep that tissue alive. I hope this makes sense for you. I hope it actually clears a lot of things up in terms of blood supply of the scapula.